Hi there. So good to see you. I would love it if you take just a moment to let me know if you're hearing me. Let me know if we've got audio. Let me know if we've got video. Are we good? Are we good? Sounds great. Fantastic. Wonderful. Welcome to today's mini class. It is so good to see you here with me today. I see names that are familiar. I see people who are new to me. Welcome. Good to have you with me. I would love just a little comment from you in the chat box. I want to know if you are new to iridology or if you have iridology training. And if you do, I want to know what kind of philosophy you've got. Is it Jensen? Is it constitutional? Is it emotional? Let me know in the chat box. That will help me to craft this presentation a little bit more on the fly so that I can meet your needs better. We've got some people who are new. Thank you for letting me know that you're new. That helps me a lot to be able to craft what I'm going to teach you and put it at a level that is going to be useful for you. So thank you so much for that. Anyone else care to weigh in on that? Are you new to iridology? Do you have Jensen training? Do you have constitutional? Do you have emotional? Do you have some other kind of iridology training? That would be helpful for me to understand. Okay, so good, so good. We do have a very small group, and it's not the smallest we've ever had, that's for sure, but it's a small group, and that means that I would love to have interaction with you in the chat box. So if you've got questions or comments, drop them in there, and I will take time to answer questions at the end of our presentation today. So be sure to be interactive with me here. Just letting you know that the next cohort, the next start date for dynamic iridology is June 27th. And if you are interested in learning more about that course, particularly if you're a holistic health professional and you already have anatomy and physiology under your belt, you've done a separate course in your studies in anatomy and physiology, or you are a licensed medical practitioner like a registered nurse, an MD, a physiotherapist, things like that, then I invite you to grab this URL that you see on the screen, tinyurl.com/dynamic-iridology, and book a time. Use that link to schedule a time to chat with me about the course to see if it's a good fit for you. See if it's the right iridology program for you to enroll in. All righty. So with that, just need to remind you that everything we're talking about today is educational only. We don't ever, did I say that enough times, diagnose or prescribe using iridology. You are responsible for any results you get, good or bad, from using this information. And if you're going to use this information with clients that you work with, make sure you know the laws where you live. That is your responsibility, because every state, every province, every country has a different set of laws regarding iridology, who can practice and what they can do with it. So let's dive right in. Again, we've got to start with the very foundations here of what iridology is. Iridology is the assessment of the iris of the eye. And as iridology research has continued to develop, we now also include assessing the size and shape of the pupil and assessing things that we see in the sclera. And we need to be able to compile all of that, put it all together, correlate it so that we have that deep, deep understanding of how to work with this particular client. So why would you want to learn iridology? Well, because again, this gives us so much insight. The pupil tells us things about spinal alignment and the nervous system's impact on different organs. The iris shows us what your genetic, what your inherited gifts are. What did your parents, your grandparents, and your great-grandparents give you? It also tells us, when we look at the sclera, it tells us what you're doing with that gift. It tells us where we've got things going on that will need attention. And it's not that the eyes give us the answers. The eyes don't give us disease names, but they absolutely do help us to understand what questions we need to ask. They help us to correlate our clients' symptoms so that it makes sense. We understand why they've got the symptoms, and then we can create recommendations for the client. So again, we do iridology so we can assess our clients more quickly and accurately, so we can stop working unpaid overtime developing client programs, so we can stop overwhelming our clients with over-the-top, undoable programs, so that we can create programs that will increase client compliance, success, and long-term retention. That is so important. Doing a one-off appointment doesn't benefit anybody. A one-off appointment does not help your clients by much, because it just gives them a little bit, or you've given them so much information that they're picking and choosing the bits they want to use. And so that doesn't help them. And it doesn't help you because you're constantly having to find new clients. So when you do iridology the way I teach it, I teach you how to use the iridology to address your clients' concerns and to build their programs incrementally in steps that your clients can actually do and be successful with. And as they are more successful, they want to come back for more and more. They want to know what you know. They want to know what you know that will help them, right? And when we do iridology this way, it helps us create faster and deeper rapport with our clients. I don't know what the medical world is like where you live, but where I live, about half the people here don't even have a family doctor because we have a doctor shortage. And if you do have a doctor, there will be a sign on the wall saying you can ask about one problem in this appointment, and your appointment may be 10 minutes long. That's on a good day, right? So it's really kind of brutal here. When we do iridology and we're able to create that deep rapport and find out what our clients are concerned about on all levels, and then begin crafting the programs that will help them to step out of those problems, we really earn our clients' love and respect and trust, right? When we do iridology this way, it helps us see more clients in less time and with less energy investment. So that doesn't mean we're going to be doing 10-minute appointments. What it means is, the way I was originally taught to do iridology, I would see the client, I would take that information and the photographs that I'd had of their eyes, and I'd spend a couple of hours outside of my paid time writing up reports to bring back to my client in our next appointment. Well, if I spend 2 or 3 hours writing a report, that's 2 or 3 hours that I could have spent seeing a client. And so when I teach iridology, I teach you how to do the assessment and the creations right in your appointment time. So there's none of this report writing stuff, right? That time that you spent writing reports, you now can decide what you were going to do with that, because you're not going to be writing reports. And because it's going to free up time, you're not writing those reports, it will allow you to potentially see more clients and thereby increase your income without even raising your fees. The inflation has been so crazy here in North America this last couple of years that, you know, anything we can do to not necessarily raise our fees but increase our income, that's a good thing. So my name is Judith Cobb. I have been an iridologist for over 4 decades. I originally learned the Jensen style, and after several years of practicing that and thinking, yeah, I'm not happy here, this isn't working the way I was told it would work, I moved over to constitutional, and I love, love, love that. I'm also a master herbalist, a natural nutrition clinical practitioner. So I work with all of those strategies when I'm with a client. And I was originally taught that if I put a client on a specific diet, that I could change their eye color, that I could change markings in their eyes and in their irides particularly. And that is just not something that I've ever seen happen. And that's a part of why I left that style and moved over to constitutional. The other thing I love about constitutional is it helps me to integrate everything I know about nutrition, about supplements, about aromatherapy, about flower essences, about emotional well-being, tapping techniques, things like that. Helps me to integrate that into my sessions on an as-needed basis. I can pick and choose what I need to offer to my client. How does that sound? For those of you who are new to iridology, does that sound like something you would like to add to your your practice to what you do to help clients. If that sounds like something you would like to add, give me a big fat yes in the comments box. Yeah, fantastic. Love that. So good. So good. So again, iridology helps us do faster assessments, be more accurate because we are correlating symptoms to eye markings and using that to help us ask the right questions to get the answers we need to move forward. And it helps us to better and faster rapport, and it eliminates the need for an intake form. You still need a release form, that informed consent form, but my clients never fill out a questionnaire. I think questionnaires are a waste of time. And so I teach you how to do this without. I am a level 3 certified iridology instructor with IPA. IPA has us, oh, I should have put my new badges up. Oh my goodness, I am renewed. Honest, I'm legit. I'm good until January 2026 here. I should have updated that slide. Oh my goodness. IPA has iridologists and instructors update their credentials every 2 years. So we have to submit CEUs. So I've been with IPA for many years. They just started doing badges a few years ago. And so I am one of only 8 level 3 certified instructors in the world to date. And I've designed many courses on herbology and nutrition, and I've written books about them, which have been self-published and are now out of print, except for my dynamic iridology textbook, which is available to my students. I have professional memberships with these 2 Canadian nutrition organizations and with the Alberta Herbalist Association as well. Okay, so that's enough about me. Let's talk about the 3 constitutions of constitutional iridology so you can see how iridology can work as an assessment tool. We'll look at why iridology is only an assessment tool, because as a practitioner, you need to have other modalities, right? We can assess. And so what if we assess? We understand where the problem's coming from. We need a way to make recommendations. We need to have tools to help us recommend things to our clients that will be helpful. And that's where herbology and nutrition and aromatherapy and things like that come in. All right, and so we need to also remember that the irides are inherent. And we're going to focus on the irides today. They are inherent. They show us predispositions. They don't show us absolutes. They're not a crystal ball. They give us insight and understanding. So we're going to need to ask some questions about our client's health history, right? We're going to need to know, have they had surgeries? Have they had a medical diagnosis? Because we can't name a disease, but if the client brings that name in and we know what questions to ask, we can choose to agree or disagree with it in our own mind and then work from there. We also want to know what medications are they on, because that will or can alter the recommendations we make. We want to know what the family history is. And we obviously want to know what their diet and lifestyle are like, because a person can be predisposed to various things, but if they've got a really healthful lifestyle, they may be averting all of those issues. They might have, their eyes might show they're really not predisposed to too much, but if they've got a really awful diet and lifestyle, they may be creating problems for themselves. Does that all make sense? If that makes sense, give me makes sense in the comments box. And so with this, then we're going to be looking at the 3 foundational constitutions today. And just know that this is simply the first layer. It's the very first thing we assess that we see when we are working with a client. And from there, then as you learn iridology, as you study it, you'll learn to add structural subtypes by basic constitution, because the 3 that we're going to talk about break down into several more layers of constitution. And then we can get into looking at specific markings, specific pigments. And because you have a background in anatomy and physiology, when we see these markings, we can begin to understand what they're telling us about the client's symptoms. Rather than saying one marker equals one problem, we can say, oh, client has this problem, And this marker means that this organ wants to do this, which is going to impact this mark over here for this organ. That's going to impact this other organ here. And that's going to lead us right here to where the root of the problem is. So we're going to, as you learn iridology, you will learn how to, hopefully, if you study with me, you'll learn how to connect the dots and trace things back to the root problem. The sclera also adds another layer of information. The cornea adds another layer, actually, and so does the pupil. So let's keep all of that in mind while we look at the first constitution we're going to study today. This is the lymphatic constitution. So the lymphatic constitution is, think of it as your basic blue eye. There's a little more definition to it than that, but for today's purposes, think of it as your basic blue eye. If you can see blue in the iris, it's a lymphatic constitution. Now, the other thing we want to be aware of is you've all seen iridology maps that are all subdivided into little tiny pieces. When we're doing constitutional iridology, mapping is the very last step of the process, because when we know the constitutions, it gives us a huge foundation of information. And we probably don't need to get to slice and dice down to little specifics in a first appointment. So when we look at an eye like the one we're looking at now, this is really just a perfect example of a lymphatic eye. We're going to see some blue, and we will also see some of these threads in the eyes. You'll often hear us refer to them as fibers. That's not really what they're called. We get lazy and sloppy, so we're just going to call them fibers for today. We might have other colors sitting on top of this eye as well, but as long as we can see some blue, we can call this lymphatic. Now, when we see a lymphatic iris, we know that our common health concerns that we are likely to see more of in a blue-eyed person in a lymphatic constitution are things like problems that center around their mucous membranes. Their acid levels, but not stomach acid. We are talking blood and fluid acid, so tissue acid, not stomach acid. We're also talking about the potential of problems with the lymphatic system, as the name implies. So when we see someone who has lymphatic irides, one of our first questions is, and I always start out really broad, right? And then I laser it down to where we need to be following the information to get to where we need to go. So one of my first questions is there a personal or family history of anything? I want to know, what does this client know about their own health? What do they know about their family's health? Going back 2 or 3 generations or 4 if they've got it. And then the next question, if it's appropriate, is going to be, is there a personal or family history of asthma, allergies, arthritis, eczema, psoriasis, kidney issues? And going back to your anatomy and physiology, you will know that each of those disease processes is an indication of tissues that are out of balance as far as their pH is concerned. Right? You can't have asthma if you have well-balanced pH. You can't have allergies if you have well-balanced pH. You can't have arthritis or eczema or psoriasis. And of course, the kidneys do a lot for controlling that pH. But if their pH is off, you can be sure you're going to suffer in other areas. So I'm not looking at tiny details. I mean, you'll see lots of things like we've got the pigment here. We've got fibers doing this. We've got these little tiny dark spots in the eye like this. I'm not even looking at that yet. That's for a future appointment with this client, probably. If those are relevant to my client's concerns right now, I'll pay attention to them. But for now, I'm just looking at this overall situation. So now that doesn't mean, if I've asked them, is there a personal or family history of, and I've gone through those situations, and we need to keep in mind that we go through that, it doesn't mean that if they have a lung issue, I'm only going to look at the lung area, right? Because there may be some inherent weakness suggested in the lung area of an iris, But it might also be that the lung is simply the messenger. The lung is the easiest way for the body to get rid of excess acid for this person. So now I need to dig deeper. Why does this person have excess acid? And now I can track that back using other markers to figure out where is the excess acid coming from. So for example, if I was working with someone who had lymphatic eyes and had a lung issue, I would look at the lung zones. I would look at the bronchioles. I would want to know their acid tendencies. I'd look at the kidneys, the lymphatics, the skin, the stomach, the intestinal tract, since all of these things physiologically have an impact on the lungs. I'd also look at the emotions, because the lungs, as every organ, are very emotional, and I want to know what's going on there. I'd also look at specific areas of the sclera. I'd look at the pupil shape, although these are adding way more depth beyond just the lymphatics. But in a consultation, in a client session, I would absolutely do that. So when we see this blue eye, we know we are looking at that risk of acid imbalances, typically elevated acid in the blood and in the tissues. This is another beautiful example of a lymphatic eye. Notice that it's a very different shade of blue. It's kind of a steel gray blue, right? And that's okay. Notice that the even that gray blue is a little uneven through the eye. We've got other colors sitting on top of this eye. So with this, this is giving us a whole lot of information, right? Do you know anyone who you think has lymphatic eyes? If you do, just put lymphatic in the chat box. Anyone who's got an eye that is blue or predominantly blue, some shade of blue, you know, someone like that, fantastic, fantastic. So I want you to think about them while I'm talking about this eye, because again, knowing that they're lymphatic gives you that base of information to start picking and choosing from. Another risk that a lot of lymphatic constitution people have is they're a little more predisposed to thyroid issues. Even when there are no thyroid indicators in the eye, we often will see an increased risk here. And the reason for that is, think through your chemistry here. If someone has elevated acid in their blood, they have to start pulling calcium out of their bones to neutralize that acid, right? And we know that we need to have that calcium as the buffer, right? We also know that the thyroid needs other minerals to be balanced. And if our pH is out of balance, we're also using other minerals to balance the pH. Magnesium is a good one. Lots of minerals help to balance our pH. And the thyroid doesn't get the minerals it needs. The other problem here is that people who tend to be over acid tend to not break their proteins down well enough, so they can't get the amino acids they need for their thyroid to build the thyroxine properly, right? So we begin to see all of these little thyroid and parathyroid things happening because we have acid that's out of balance, and we've got minerals then that are being used to try to correct things. And that means that the thyroid can't function the way it should. So we always need to be able to trace things back. So, you know, if I'm working with someone who's lymphatic, and if the questions are appropriate, I will ask, is there a personal or family history of thyroid or parathyroid issues or of bone issues? Okay, but I'm not asking those questions of every client. I am asking those questions of clients where it is appropriate based on the conversations we are having and their desired outcome. We always start with what is the client concerned with right now? And that will occupy our first probably 2 to 4 appointments. As we make progress on those, and the client is feeling much better, and they're thinking, if I feel this good, I could feel way better than this even, then we can start diving into things that I see in the eyes that the client has not expressed a concern about, and we can start talking about those. But we always start with that focus of where the client wants help. Again, our goal here isn't to use iridology like some kind of crystal ball. This is not a party game of guess what's wrong with me. Constitutional iridology is about understanding the constitution of the person, so we can understand where they are less resilient, where they are more resilient, so we can begin to help them craft their diet, use appropriate supplements, lifestyle, work with emotional patterns, whatever it takes. The goal here is not to change their eye, because we're not changing their eye. We're not going to take any of this extra color out of the eye. We're not going to dissolve this pigment. This does not mean this person is toxic. It simply shows us where the predispositions are. The client's symptoms tell me if there is toxicity there. And so the goal isn't to change the eyes. The goal is to improve the client's health and to teach them better health hygiene. Does that make sense? If that makes sense, just give me some kind of a little emoji in the chat box. So that is the tip of the iceberg for the lymphatic constitution. There's much more information that we could go into, but we don't have time to do that in these mini classes. Here's what one of my grads said. This is Sharon Bimrose from Australia. She's a naturopath there. I'd already taken iridology as a part of my studies as a naturopath. However, Judith's course, Confident Nutritionist Dynamic Iridology, we just changed the name. It's now Dynamic Iridology Assessment System, surpassed my previous training in structure, content delivery, documentation, and support. Iridology has certainly reduced the time required for prioritizing a treatment plan. Iridology, without a doubt, has been a huge game changer to my practice. Love that. That is the goal here. That is the goal. The goal is to simplify your work, reduce your workload, but deliver even more useful information to your client, right? Isn't that kind of an odd thing? Usually we think it takes more energy, more effort, more time to deliver goods to our client. And yet the more time we put into it, the more breadth we give, the more depth we give on all these different levels, the more likely we are to totally snowball our client. So iridology helps us to laser focus so that we can address the things that our client has asked for help with and get them started making progress. Here is a true brown eye. Do you know anyone who's got a true brown eye? If you do, give me brown eyes in the comments box. We call these hematogenic. This is the hematogenic constitution. What you will notice in here is we've got brown and we've got some golds. Sometimes we don't have golds, but sometimes we do. So what we're looking for specifically is there's no blue in the iris, and we do not see any of those fibers. There's enough pigment over this entire iris that it has veiled the fibers. Now, when we're looking at a hematogenic eye, and thank you everyone who's dropping the comments in the chat box. I love that. And again, drop comments and questions in there for us to answer at the end of our time together today. That would be perfectly lovely. Our key areas of concern, that's maybe a strong word. The areas where we see the strongest predispositions for imbalances, that's a much better way of describing it. In a hematogenic eye are the blood and the liver. The blood and the liver. Does that mean that every person with a brown eye is going to have a liver problem? No, it just means there is a greater likelihood of it. Is every brown-eyed person going to have a blood problem? No, it just means there is an increased risk of it. And so as we look at this, again, we'll be asking questions. Is there a personal or family history of anything? And then depending on our client's concerns, we're going to begin to narrow that down. Is there a personal or family history of anything to do with your liver? Is there a personal or family history to do with anything with your blood? Now, I want to just caution you as to how you ask those questions, right? That first question, personal or family history anywhere in the family, is a very safe question. But when you start asking questions directly of one person of, do you have any history in this area? And you're looking at their eyes, they begin to panic. What do you see? What do you see there? You know, and so you want to be very careful how you use that question and how you shape that question so that you're not making your client fearful. Okay. Really, really we have to practice. We practice questions a lot in the dynamic iridology program because we need to be very skilled at how we ask questions so that we do not create an emotional situation for our client, right? So important. We're not here to upset them. We're here to empower them. And that's a huge difference between what we do and what the medical world often does. Right. One of my oldest son, it would be 4 years ago, was diagnosed with colorectal cancer. And that news was delivered to him just in a very, just this is what you've got. And there was no way of giving him that information. There was no effort made to give him that information in a way that would prevent his whole being from going, oh, right? And of course, after that diagnosis, he came to see me. He did end up with surgery, which was fine. No chemo, no radiation. But he came to see me. Of course, he's my son. We talk a lot. And he wanted to know, okay, what do I do with this, Mom? How do I make this become a non-issue? And we did a lot of work emotionally and with supplements and with diet and all kinds of things to help him to be able to relax and go, okay, this is a temporary situation. Cancer will be removed. It was only stage 2, so that was great, had not spread. And it meant that we could really begin that healing on the energetic level with him by getting him to just be calm and centered, right? When we see people with these hematogenic eyes, we want to broaden out that idea of blood and liver a little bit. And this will help to soften things as you're working with your client. Depending on where you see markers or depending on your client's symptoms, we can also see issues. Again, broadening out the blood and liver ideas to spleen, stomach and digestion, circulation and heart, vascular system. These people will tend to be a little too alkaline in their pH. They'll be on that more alkaline side of things. And of course, we need a certain amount of acid to actually assimilate our minerals, many of our minerals properly. So if they're too alkaline, they may not be able to assimilate minerals at the rate that they need, that their body needs them. We may find mineral imbalances because of that, especially calcium. We know that those minerals are critical for the endocrine system and for metabolism. So we may see that spill down effect of endocrine metabolism issues. So again, depending on what symptoms or imbalances your client wants help with, the questions you might ask based on iridology could include things like this. Is there a personal or family history of blood imbalances or of allergies, which would have a liver impact, right? The liver will impact the allergies. Immune, because the liver has an impact on the immune system. What about hormonal issues? Again, liver plays a huge role in that. What about blood lipid imbalances? So how's their cholesterol? What are their triglycerides doing? What about weight issues? And so you don't necessarily need to say, is there a personal or family history of a blood disorder or of a liver disorder? Because again, those are kind of scary areas. But if your client is asking for help with weight loss, then it's a good idea to ask about blood sugar and to ask about cholesterol, right? And to ask about digestion and then to ask about diet. And you can learn what you need to about the liver by asking questions that go around the edge of the liver questions. How is this working for you? Is this all working? Is this information that's going to be useful for you? Fantastic. We're seeing great here. That is so good. Thank you for that. So if you know someone who's got brown eyes, hematogenic eyes, yeah, that's what you're going to be watching for. Do they have those kinds of situations? Again, tip of the iceberg, tip of the iceberg. So much more we can talk about with the hematogenic. Another one of my students said this. I studied iridology with David Pesic in 2006, and she already had his level 1, 2, and 3 certificates. And iridology and professional practice with Darko Purse. And she became an RNCP in 2012. However, this is the most amazing iridology course I've taken. Judith's course is top on my list. Judith's iridology course is very complete as it contains the most accurate iridology, including sclerology, and most importantly, how to put it all together and make a proper assessment. I feel very confident in my nutritional practice now. This is so, so important. You will find, and it's just the way some people do it, many iridology teachers teach you the markings and then they tell you you'll figure out how to use this. That's like me giving you a wrench and putting you in front of a car and saying, you'll figure out how to fix the car. Right? In my opinion, that's too huge. So I do teach my students how to connect the dots, how to work the iridology into an assessment. Not that I want them to use what I teach them as the only possible way, but that I want them to have a launching point. And from there, as they use it, they will shape it to be what they need it to be. But at least they know, here's the wrench, there's the engine, we're working on this spark plug, right? And they've been shown how to change the spark plug. Now they can change that spark plug and all the rest of the spark plugs as well. So that's my goal. I don't want iridologists who just know markings. I want iridologists who are also confident practitioners. That's the goal of the course. The third type, the biliary iris. So when you see bili, what does that suggest to you? Bili. What does that suggest to you? Bile. Shannon, good work. Good work. What organ creates the bile? We've got gallbladders where we store the bile. Excellent. And what organ creates the bile? We're digging into your anatomy and physiology here. And I know you know this. Someone knows it. The liver, Shannon, thank you so much. That's exactly it. Michelle, thank you so much. Really appreciate that. So when I first learned to do iridology, I was taught that an eye like this, where I could see some of the fibers, but there was all this other pigment sitting on top, was a toxic eye, that this person needed long-term cleansing in order to be well. And we had to cleanse really, really deep. And I can't tell you how many of those programs I put together in my early years. And we cleansed and we fasted and we used supplements and the eyes did not change one little bit. But my client's health did. Again, the end result that we're looking for is improved health, not changes in the eye. So with this, again, constitutional iridology says this is all inherited. This has all been passed down through the generations. And that means that we are looking at the person's constitution. How are they put together? So the biliary eye will have no blue in it, but we will see fibers. Remember your lymphatic, we had at least some blue and fibers. Here we have no blue, but we have fibers. So we've got some pigment in the eye, but it's not thick enough to cover all of the fibers in here. We'll sometimes have gold in here. Sometimes we'll have other colors in a biliary eye, more yellows, more oranges, more browns, but we'll always see fibers. We'll often see a darker area towards the center of the iris as well. Do you know anyone who you think might have a biliary eye? If you do, give me biliary in the comments box. So with these lovely biliary eyes, our questions want to circle around the idea, again, primarily of liver and digestion. Now, in truth, your biliary person is usually the offspring of a lymphatic parent and a hematogenic parent. Somewhere in that bloodline, there had to be a hematogenic person, and that's where we're getting the brown pigments here from. And so we are going to see that this person does have some tendencies of the lymphatic, maybe some of the hematogenic as well, very likely. And really where that's going to focus is digestion, liver, gallbladder. Now, you know that the liver does at least 650 different jobs that we know of so far. And amongst those jobs are immune, lipid balance, blood sugars, triglyceride balance, managing allergies, and there's so much more. We also, with the biliary eye, pancreas is often a player here, right? Liver and pancreas talk to each other to regulate blood sugars and to regulate cholesterol levels and things like that. So we often see a pancreatic influence here, and we'll often see an increased risk of gallbladder kinds of situations. And of course, when we're talking gallbladder, we also need to be talking about emotion, but we're not going to take time for that today. So with this, then, the questions will be things like, is there a personal or family history of? And it could be immune issues. And I might not ask it that way. I might just simply ask, how's your immune system been? Do you feel like you're getting sick a lot? I want to know about lipid balance. Have they had their cholesterol and their triglycerides checked in the recent past? Right? Is there a history of that being elevated? I want to know about blood sugars. And I often will ask for them to bring from their doctor the hemoglobin A1C test, because that actually gives me, I feel, more useful information than a fasting glucose test, right? I may want to ask about allergies, right? Are you aware of any allergies? And they'll often say, well, I haven't been tested. And I'll say, but is there anything that you suspect? Do you suspect any allergies, foods or environment or seasonal things? And then, that gets them starting to think about how they feel. Certainly ask them about gallbladders. Do fatty foods cause problems for you? Have you learned to avoid any foods because they cause problems? And when your client gives you that list of foods that they don't eat because it causes problems, that's going to help you to understand whether it's a stomach, gallbladder, intestinal kind of issue, right? Right. And so we've got lots of questions that can be triggered from this based on what our client has asked for help with. We always want to frame the questions we ask so that they are always connecting our client's symptom to the client's eyes, right? That's how we maintain rapport. All right, how's this going for you? I'm curious to know, as we're into the last few slides here, what have you learned? What is your biggest takeaway so far today? This is Karen. She is an IPA certified iridologist. She's been certified for quite a few years. We're going to read this. Judith, I just returned from a regenerative detox course where iridology is implemented. I spread the word about what a wonderful teacher you are. Most people I talked with did not have anywhere near the same experience with their iridology education, no support, unanswered questions, and a lot of confusion. Mostly, they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported even still as I graduated almost 5 or 6 years now. It's been a while. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Thank you from the bottom of my heart. I am eternally grateful for your never-ending patience and support. And she's absolutely correct about that. Even especially with the teaching of iridology, I have had students come to me who've been certified by other practitioners, and they've been certified by IPA, but they're coming to me saying, yeah, I can spit that facts. I can answer questions on a test, but I don't know how to use this clinically. And so they're coming into my program to start right at ground zero and learn all the markings all over again, but also to learn how to use it in clinic. This is so important, so important. Karen went on to say this when I asked her how has it helped her in her business. Iridology's helped me to understand the relationships between different organs and organ systems more in depth. Iridology also gives me an advantage of seeing the potential for different genetic traits and qualities that may be underlying. By observing the constitution, for example, you can extrapolate how the person's body will likely respond to applications of healing methods. Therefore, it has helped me to expand my knowledge and increased efficiency at providing more precise recommendations for health-oriented options. I so love that. So, Iridology can help you to assess your clients more quickly and accurately, help you stop working unpaid overtime, creating reports, whether you do iridology or not. If you are spending time writing reports for your clients, stop it now. It'll help you to stop overwhelming your clients with programs they simply can't do. It'll help you to create programs that will increase your client compliance, success, and long-term retention. It will help you to create faster and deeper rapport with your clients. I often hear at the end of a first appointment, I've told you things I've never told anybody else. And it's like, holy doodle, that's good rapport. It'll help you to see more clients with less energy or time investment. It will help you to increase your income without raising your fees. So if you want to learn iridology at a professional level with full support, this is the URL you want to use to schedule a time to chat with me. Let's see if this program is a good fit for you. Now, it truly is designed for people who already have a college level anatomy and physiology program under their belt. All right, so let's slip back here and look at the rest of the comments that came in. The connection to pH, do you implement RBTI? No, I don't use RBTI. You can really get a good feel for their pH based on their symptoms, right? And they're not going to be testing their pH with an RBTI all the time. So I prefer to get them to be paying attention to their body to understand where their pH levels are, right? HD Zoller said, easy, quick glance of the eye that can open doors that would normally take a lot longer while working with a client. Yes, yes, exactly. Exactly. Iridology is brilliant for that. Ask, and Martha says, ask questions that connect with eye markings, address their concerns. Absolutely. Absolutely. So I appreciate those comments so much, so very much. That's exactly why, a part of why we want to do iridology. So with that, my friends, I hope you found our 45 minutes or so together to be useful and beneficial. If you are ready to look at an iridology program that will prepare you to certify with the International Iridology Practitioners Association, that would be an ultimate final destination. If you just want an iridology course that's going to be useful for you in clinical practice, that's going to help you be more effective and all those good things that we listed on that one slide, then, and you've got your A and P under your belt, then schedule a time for us to chat. There's only a few slots every week, so go ahead and grab one and let's talk, and let's see if hopping into that June 27th start date is going to be a good idea for you. I look forward to seeing you again in the near future. Watch your emails for the replay link for those of you who might want to go back and watch this again. And we will see you soon. Take good care. Bye for now.